Welcome to Doctors in the House. My name is Dr. Darrell Hill, your host, and today we are privileged and happy to be talking all things teeth and dental care. We're lucky to have Dr. Garland Davis in the house. Some might call him the best dentist in the Laurel area, if not the state of Maryland.
Oh, my goodness.
So at this point, I'm going to give Dr. Davis a chance to introduce himself.
Well, hello, Dr. Hill. Thanks so much for having me here.
My pleasure. My pleasure.
Yeah, I'm Dr. Garland Davis, practice in Laurel, Maryland. And one other fact that folks would want to know, we are also mutual patients of each other.
Absolutely.
Yeah, so just really delighted to be here, just to enlighten folks as to who I am, what we do, and what's going on in dentistry these days.
Yeah, and that's great because as our viewers have learned over the past episodes, we're all about education, health, and now we're focusing on dental issues. So today, let's get right into it.
Sure.
What kind of things are you typically seeing in the office when it comes to dental care? Just give us a sense.
Oh, boy, the gamut. My practice is mainly adults. Again, the primary thing that we see most of the time is gum disease.
Okay.
Gum disease is always number one culprit. Just one of those things that just never ever seems to go away.
Right.
Yeah, just.
And I think it's funny too because with gum disease, it doesn't always hurt. And doesn't always give you symptoms, but has some significant issues. And we'll get into the connection to the medical part of what's going on. And that's why I'm glad you're here, because we get to share this and we get to hear from you firsthand, somebody who's in the trenches, making it happen. So typically somebody with gum disease, give me an idea how they present to you.
Well, normally, like you said, most folks come in and they have no idea that it's there. And usually for most folks, when they start to notice symptoms, it's starting to get bad.
Right.
But for most of the patients that come in, it's something that it's a discovery thing, and then we have to educate people as to this is the condition that you have.
Right.
And then you have to kind of like lay out all of the potential consequences if you don't act, even though they're not experiencing pain or discomfort.
So go ahead real quick and just mention what are the consequences.
Well, one of the biggest consequences, I'll back it up this way. One of the main reasons why, especially like in my male patients, the ones that are married, their spouses send them. There's a complaint of breath odor. Okay. And that's usually, you'd be surprised how many guys come in, and my wife's told me to come, she said, because I have bad breath. That's usually the number one sign that something is not right.
And, it's funny as a side note, I saw someone in the office last week, and I'll tell you, man, that was his major concern. It was my first time seeing him, and it was so powerful because as we're talking, he literally would look this way when he was talking. It was that much of a problem. And it was my first time meeting him. He'd already seen at least one or two dentists. Of course, I had you in mind, and might have even mentioned your name to him, by the way.
Hey, send him on up. We'll take care of him. Yep.
But to someone like him, what might he see to suggest to him that he's got an issue?
Well, the other thing too that people notice is that their gums are bleeding when they brush. They're brushing their teeth, and just routinely they brush, and then they go to the sink, and they expectorate or spit into the sink, and they notice blood in the sink, and then it's an alarming thing for them. That's the other thing that kind of alerts them that there's a problem.
Now, is it fair to say blood is never a good thing when brushing?
Usually, blood is usually an indicator that there's something going on. It's always indicated there's some type of inflammation going on. The gums are inflamed or irritated.
Wow. Yeah. And I know we just jumped right into it with the whole gingivitis issue. Is plaque a part of that too, would you say?
Plaque's the main culprit. Plaque is it's a primary factor in gum disease, and it's the degrees of plaque that actually that bring upon the degrees of gum disease. So you can have someone with a light amount of plaque, and they'll just have a little bit of bleeding with their gums. You have someone with a heavy amount of plaque, and you'll see more bleeding, more swelling, more redness. And then you have folks where the plaque is so heavy that it literally buries their teeth.
Wow.
Yeah.
Wow.
And that's the more severe issue. Yeah.
Right. Because for our viewers, I guess a couple of things are happening here, including maybe bone loss and stuff like that. That's when it's really bad.
That's when it's bad. And again, with bone loss, the thing when you mentioned bone loss, that's one of the things that you have to make people aware of. Usually, folks are unaware of things like bone loss and destruction of the gums and the surrounding structures until you put it on an X-ray or a picture or something.
Right.
Or there's bleeding or swelling. Usually, pain doesn't happen until it's way too late.
Wow.
Yeah.
Yeah, and I think we could probably talk the whole show on this topic, by the way.
Yeah. And the other thing too is there's been medical studies with gum disease and related things like heart issues and heart disease and there's some correlation with that. So we always tell people to get their mouths healthy as possible, keep the rest of the body healthy. Mouth is a gateway to the body.
Right.
Yeah.
And I guess since we're on the topic, what would you say are the usual maintenance issues as far as brushing and flossing? Because I'm sure all that's going to help this.
The biggest thing with maintenance, and I don't want to get too political or thing with maintenance, and the biggest thing with maintenance is that when a person has gum disease, it kind of takes them out of that routine. You always hear come to your dentist twice a year, right? Right. So with gum disease, it pulls you out of that routine twice a year thing. So you have to go into a more frequent intervals of treatment. And sometimes that conflicts with people's dental insurance and coverage and that thing. So you get resistance. You get resistance. You get resistance. And, it is not necessarily what's best for the patient, but, usually when someone has gum disease, you have to put them on more frequent intervals coming in. Yeah.
So what do you think? How many times a day should someone brush their teeth, and how many times maybe flossing too?
Well, we always recommend twice a day. Okay, brushing. For brushing, flossing, I'd say anytime food gets stuck between your teeth after you eat, just get it out as soon as you can. But brushing, usually a minimum twice a day. There's some people more fanatical about it, but I usually tell my folks twice a day, no less than twice a day.
Right. Any particular toothpaste you might recommend?
I have a funny saying about that, and people may get on me, but I always tell folks buy whatever's on sale. Okay.
Wow. And why do you say that?
Because as you well know, there's marvelous marketing going on out there, and they can repackage it, rebox it, put all kinds of sparkles in them, and they basically are the same ingredients in each and every, and you can spend $5 for a tube of toothpaste, or you can spend, it's really technique of brushing and flossing and that sort of stuff.
And once you're going to share with the audience, what is the most important ingredient in toothpaste?
Well, I believe it's like lauryl sulfate or something like that. It's basically soap kind of.
The fluoride.
Yeah, well, fluoride's in there too, but you can go fluoride, non-fluoride. People put baking soda, But again, if you look at a box of Colgate versus a box of Pepsodent versus a box of Arm & Hammer, they all have the same basic ingredients.
Wow.
They all.
Marketing 101.
Yeah.
Wow.
Yeah.
Interesting.
Yeah.
And plus, I guess with water has fluoride in it too, which is supposed to.
And there's pros and cons about how much fluoride someone should use these days, which I'm not an expert on. I've read stuff on it. I still would recommend fluoride for my patients, and I do. Yeah.
Wow.
Yeah.
Good stuff. So let's talk about cavities. What exactly is a cavity? That's another issue.
Okay. So a cavity is basically you get bacteria that literally perforates the hard enamel of the tooth, and it can work its way into the base. A tooth has 3 layers. It has a hard outer layer, a middle layer, and then in the very center, nerve tissues, lymphatic tissues, blood vessels, Right. What happens is bacteria first, it penetrates that outer hard layer, and then it gets into the softer middle layer, and that's when it can spread, and that's when the spread starts. Okay?
Wow.
But it's just bacteria literally chewing its way into a tooth.
Wow.
Yeah.
And that's just the oral cavity bacteria?
Yeah, that's
pretty much?
your good old staph and,
Wow.
Yeah, just good old bacteria. Yeah.
And how would you treat something like that?
A very basic procedure. you stuff that everybody likes. You get your Novocaine delivered through, a what, and you use a drill,
Right.
and there's different size instruments that you use depending on the size of the cavity. Again, it's one of those unpleasantries that people don't like about what I do.
And
but
it's funny.
I
think it's incredible because it's changed so much over the years.
Yeah.
And
there are lasers. They
Right.
do have lasers in. Yeah.
And I know back in the day, people were terrified of going to the dentist, and now with sedation
Right.
and making people more comfortable,
Right.
it's not as bad as it used to be.
Right. Yeah. Now, the sedation is degrees. You can get into all kinds of degrees of sedation.
Right.
Generally, I don't sedate my patients for routine type services.
And when I say sedation,
yeah.
I guess I should say anesthesia.
Yeah, and it's a local
or
anesthetic.
Or local anesthetic.
It's more suffice in order to.
Because I got to be honest with you. When I came to see you, you hooked me up.
Okay, good. Okay.
I had no real pain.
Okay,
and when you know what you're doing and you hit that nerve the right way,
you were numb.
it's comfortable.
Yeah, you were numb.
And if I get that pressure, I go like this.
Hey, let
hit
me know.
again.
Let me know.
Let me know. So
That's
I really
right.
appreciate
Yeah.
what you have done for me, because the pain that can come with some of this can be very debilitating.
Yeah, I mean, sometimes there's some post-op issues. I mean, that's with anything. Sometimes people do complain of sensitivity a little bit afterwards, but it's usually it's not the norm. Yeah.
Right.
Yeah.
And when you get into a root canal, is that a more advanced type cavity?
Yeah. Okay. So the root canal, basically, what it is, you have we were talking about the bacteria penetrating the layers of the tooth. You break through the enamel, you get into the middle part of the tooth, and then that inner area of the tooth, the nerve, that's when the decay has come in contact with the nerve. That's when the inflammation starts. Wow. That's when the pain starts. That's when you get, I can't sleep, I need pain pills, I need blah, blah, blah. But that's when it starts. It penetrates into the innermost layer of the tooth and has made contact with that.
Wow.
And at that point, you can no longer fill a tooth because you have bacteria that has invaded into the blood supply of the tooth. And you have to go and remove that blood supply, nerve tissue, and because it's contaminated at that point. It's contaminated. You can't seal contaminated tissue into the tooth.
And so that's why it's important to have your routine maintenance so you can get in there
Absolutely.
and get it early.
Absolutely.
Wow.
Absolutely. Yeah, and that's why we, when we come in, we take X-rays, and it's just, and it's usually not every checkup, but usually every 6 months we take some limited or some portion of X-rays, and it's mainly just for detection.
You can see the cavity on X-ray?
Oh, yeah.
Oh, really?
Oh, yeah.
Okay.
Especially with today's digital, you can get really, really refined.
Like air or something like that?
It's just, things, and I guess we'll get into it later. Technology has improved so much.
Wow.
That there used to be, back in the day, I'll say, because I've been doing this for a little while now, where X-rays were all like chemicals. It was you take the picture on film and then you had to dip it in, almost like process it, dip it in some stuff. And you come and you look at it, and it's this little thing. Now with digital X-rays, you can literally take a picture of someone, blow it up 30 times.
Wow.
And it's still accurate. Okay, and you can, it really has improved my ability to diagnose the smallest little increments and things. Yeah, so it actually makes you a better doctor, makes you a better dentist. You don't miss as much stuff.
Yeah, that's good stuff, man.
Yeah.
So what other kind of things are you seeing in the office besides the gingivitis and the cavities?
Again, like I said, I see mostly adults. I see a lot of folks with missing teeth.
Okay.
And they've lost them for whatever reason, either through neglect,
right?
Either through gum disease, where it's gotten so bad they had to have teeth extracted. And then it's just a matter of, how do they want to go about replacing those missing teeth. Yeah.
So is that something you would do?
Oh, yeah.
Okay.
Yeah.
And the other dental oral surgeon type?
Yeah.
What are they doing mainly?
Oral surgeons, now, I do a variety of things in my office. I do extractions, but only to a degree. Okay. an oral surgeon comes in, when I see things that require removal of a lot of bone to get access to a tooth, I will refer to an oral surgeon because it's just it's a bit much. It's a bit much. There's certain things that they do very well.
Wow.
Yeah.
Now, is there anything unique about your office compared to other dentists that you want to share with the audience?
Yeah, I just to toot my own horn a little bit. Yeah. And you probably hear this just about. I think every dental office will say that they deliver the best quality service and that sort of stuff. I think for me, I remember back when I wanted my own place. I used to share an office with another doctor, and I just remember that our styles just never meshed. He was very conservative. I was very enthusiastic. Okay. He was, he's elevator music. I'm Parliament Funkadelic, Right. And, I knew that I couldn't exist like that forever, okay? So anyway, make a long story short, one thing that you get when you come to my office is you get a friendly, family, personality-heavy staff. Yes, I can do a good crown. Yes, I can do a good root canal. Yes, I can, I can place good implants. But the thing that I pride my office most over, I think most dental offices, is customer service in the way that we treat you. Bar none,
because when I think about your office, one of the things that comes to mind, you guys were the first ones to have that answering phone system where people would pick up the phone and say, "Thank you for calling."
And
something about a smile that came afterwards.
Yeah, so that
was really cool.
It's funny now. I can't remember how it goes. It's a great day at Dr. Davis's office.
Was that something you came up with, or your wife came up with?
It's funny. I forgot who we got that from. I actually did rip that off from another job. I got to be totally honest. But it's a great day at Dr. Davis's office.
I like that. That was really cool.
Yeah.
So why don't you go ahead and just share where you went to school, and let's hear about that.
Sure. Went to University of Maryland.
Oh, okay.
Yeah,
learning something.
University of Maryland, dental school up in Baltimore. Graduated 1982.
Okay.
So been around for a little bit. I keep reminding myself how long I've been doing this, but it's funny that now that I've been doing this a lot of years, I've actually find myself starting to enjoy it even more.
Really?
Yeah,
it's good to hear. It's good to hear.
Yeah. Well,
now why do you think that is, by the way?
It's the technology's changing.
Oh, okay.
It's technology's changing, and I'm one of these guys that, even though I'm getting older, I still enjoy new technology. I've surrounded myself with new technology, and I just it makes it more exciting. There's old modalities and ways that you used to do things, and I just one of those guys that just refuse to get stuck in these old modalities. I just won't do it. I just won't do it. And
you almost can't do that.
Yeah, no.
Times are changing, whether you like it or not.
Times are changing, and it just makes you more efficient. It just makes you more efficient. So I really like the some of the newer digital devices that are out now. It just makes you way more efficient, and these things are less invasive.
Right.
Okay, so that it's more comfort for the patient, it's more convenient for the patient, saves patient time. So I'm loving a lot of this stuff that's out now. So
I guess it's good too when you can have your fundamental knowledge and now apply it with this new technology. It's got to be great. So now dental school is 4 years?
Yeah, 4 years dental school. I didn't do a residency. I went right out and just started working.
Was it a requirement?
No.
Oh, really?
No.
Lucky.
I did. I worked.
You guys are lucky.
Yes, yeah. And I'll let you know a secret. Is one of the reasons why when I was, deciding back what I was going to do, whether I was going to do dentist or go to med school, I was like, those guys got us go to school forever.
I always knew you were smart, man. I always knew you were smart.
Those guys go to school forever. That's it. So I did work in some clinics, you know. So you get your training, you get your training somewhere. You just didn't jump out and open up my own
What do you
practice.
remember most about dental school? Tough question.
scrambling.
Really?
Yeah. It was, and I say scrambling. It was just this continuous effort to stay ahead, stay on top.
Wow.
It was, I mean, hours and hours and hours and hours of study.
Wow.
And then once you got past that, then it was hours and hours and hours of clinic.
Wow.
So, it's one of those things. Every now and then I have an occasional nightmare about,
You too?
You
oh, my goodness. I thought it was just me, man. I wake up, there's an exam tomorrow,
you're still there.
and I haven't studied yet.
Oh, my God, man, yeah.
I get those still.
Yeah. So every now and then I have an occasion, not so much anymore, but I used to have those that I'm like, oh, my God, I didn't study for blah, blah, blah. I'm in trouble. Yeah.
Now, any advice to the aspiring dentist out there who might be thinking about dental school?
All I can say is, here's a big issue these days. Okay, mm-hmm. One of the things that's happening now is that it's way more expensive than it used to be.
Right.
And I know guys are coming out and they're having to encounter huge amounts of debt. So I don't know exactly how to tell a guy how to avoid that. Mm-hmm. I would tell them, come out, work, get mentored under someone, mm-hmm. and then go out and, see if opening up your own place is for you or this sort of thing. Wow. But it is just way more expensive than it used to be. Wow. I mean, with the dental education on top of opening up an office, I mean, mm-hmm. it can be crushing. Yeah.
So go ahead and share your contact information.
Sure.
How can they reach you?
Yeah. So the office is Laurel, Maryland. So at Cherry Lane. Office number is 301-490-2900. We are open Monday through Friday from 9 a.m. to 6 p.m. and on Fridays from 10 a.m. to 5 p.m. And we take emergencies. We're really, really good at accommodating emergencies. Mm-hmm. If you call, we get you in. We try to accommodate you like as quickly as possible. There isn't a whole lot of wait.
Right.
You call today, we'll try to get you in today. We'll try to accommodate you. We'll do the best we can to accommodate you. And we do have a new patient special.
Nice.
Okay.
Special.
We have a new patient special.
Special.
$99 for an exam, mm-hmm. consultation, and X-rays. And then that's just something kind of introductory thing to get people like an idea of what's going on in their mouth.
Okay.
Yeah.
Good stuff.
Yeah.
So what we're going to do is get to a video.
Sure.
And we might take a little break. On the other side, we'll come back, talk about the video, and maybe get into talking about the insurance situation and some of the finances. And we'll go from there.
Cool.
Extremely common problem. In fact, 70% or more of our population has it, and that's gingivitis. Gingivitis means inflammation of the gingiva or the gum tissue. There are two kinds of gingivitis. There's plaque-induced gingivitis and non-plaque-induced gingivitis. Plaque-induced gingivitis is usually caused by lack of adequate oral hygiene or home care. Non-plaque-induced gingivitis can be a number of other factors. It can be viral, it can be systemic, it can be due to local exposure to other factors, chemicals, but the most common is the plaque-induced gingivitis, and that is the one that typically can lead to what's called periodontitis. And periodontitis means that it's involving the area more beyond just the gum tissue, but the surrounding supporting tissue of the tooth, the bone, to be specific. Now, periodontitis tends to be more severe. You start losing bone, you lose the support of the tooth, you lose the tooth. But if we can catch it in the gingivitis stage and eliminate the gingivitis, very often we can stop it at that point and prevent it from getting to the periodontitis or the more serious stage of bone loss and potential tooth loss. In plaque-induced gingivitis, some of the symptoms that we see are redness, bleeding, little tenderness of the gum. Sometimes there is not much in the way at all. So if we have a patient who comes in, we will automatically take a sample of the plaque and the bacteria that are in the plaque and see if there are pathologic or pathogenic bacteria and or parasites in there, and we can catch that and treat it early to prevent periodontitis. If it's very early, just really good home care, good cleaning at your dental office, and good home care on your part, if you're taught properly how to do it, can eliminate the plaque that causes gingivitis and therefore very often eliminate the periodontitis that would follow. As far as home care is concerned, I think it's important to clean between the teeth, either with floss or interdental cleaners, so that you remove that plaque thoroughly between the teeth, because typically that's where gingivitis and periodontitis start. Brushing thoroughly, I'm not sure that the type of toothpaste that you use makes a real difference, but brushing thoroughly makes a big difference. Using a water cleaning device can also be very helpful, because sometimes cleaning between the teeth with floss and brushing doesn't remove everything as completely as it might, but the water cleaning device can stimulate the tissue and remove particles that may be missed otherwise. So really good home care is the key to treating gingivitis, the early stage of gum disease. Thank you for watching. Don't forget to subscribe. If you have any comments or questions, don't forget to leave them below. And remember, take care of yourself. You have a healthy mouth, you're going to have a healthier body. Have a great day.
Restore your smile and your health with the help of Dr. Nemeth and his associates. Visit drnemeth.com.
Well, we are back.
We're back.
Doctors in the house. My name is Dr. Hill, and I can be reached at 301-497-0401. We are always on at laurelmedicine.com. I really enjoyed the video. I thought it was educational. I thought it supported some of the things we talked about. So why don't we, first of all, any comments you want to make about the video?
No, it's funny. He was spot on. We had the same philosophy.
Yeah.
Yeah. So, yeah. I mean, it really is what it is. I mean, early prevention, and
Yeah. And I thought he echoed what we said about the cleaning at home and the hygienist part.
Yep.
Why don't we talk about that in your office? Besides yourself, you got a few other people. What are they doing?
Yeah. Dental hygiene is one of the most important aspects of any dental office. They're your frontline people. Mm-hmm. They are the prevention people. They're the ones that they basically keep your patient population's oral health healthy. Mm-hmm. What their primary function, they come in, they don't diagnose, but they discover things, okay? So by the time that I get to the room, I'm well informed. They will inform me as to what their findings were, and I just pretty much confirm them.
What are the kind of things they're picking up on?
Oh, just about all aspects of dentistry, and especially the patient will originate something too.
Right.
Like, oh, this is bothering me. There's an issue here. My gums bleed. Blah blah blah. And then their primary function though is to keep, as it was said in the video, is to keep people's oral health up to par. Mm-hmm. They'll come in. I'll come in. I'll sit down with the patient, and after they have pretty much delivered all the findings to me, I can go in, examine the patient, and pretty much tell them in very short order what's going on with them and what needs to be treated. After that occurs, we talk to the patient, get them signed up for treatment, okay, whatever they need to do, and then we get them back into the hygiene area.
Right.
It's most important that most of our patients, if they don't have an emergency need, that's where I want them to be, because I want them to start with a basic baseline of healthy gums, because if that's not healthy, it doesn't matter what else I do. It doesn't, because they can still lose their teeth to gum disease. Right. So definitely got to start them in the hygiene department. The hygiene department gets them in there. They do all aspects of what we call scaling, which is basically to go and remove the tartar and the plaque off the teeth, and they get the people up to a baseline of health.
Would you say everybody, no matter how good you are, there's going to be some degree of plaque or tartar?
Oh, everybody has some degree. Okay. Everybody, even I have some degree.
Even the dentist.
Even I have some degree. I'm probably due myself. So.
Well, that's good to know. Yeah. That's good to know. So, what do you think? The average person should go at least maybe once a year.
Well, every 6 months that's the baseline healthy person. Okay. But for anyone who has, especially a person who comes in and has any type of moderate to advanced gum disease, then it's 3 to 4 times a year. Okay, and it's just for maintenance. They have to go through the gum treatment, and the maintenance part of it is like almost like every season they have to be back at the office for maintenance, because if not, gum disease is kind of like diabetes. Right. Yeah, you maintain it, you know. You really never cure it, so to say, but you maintain it. Okay, yeah.
So is it fair to say that gum disease you talked about, is that reversible?
It is reversible, and you can put it in remission, so to say. Okay. Yeah, some people do get very, very healthy, but if you can get a false sense of, oh gosh, I don't have to come back for a year and a half, and you come back and it's all back, and you got to start all over again. Yeah, you got to start all over.
Well, that's good to know. And I'm glad we're taking the time to talk about this because we'll get into it on the other side, because like you're saying, people come in, get treated, they disappear, and they come back. And I guess it has a lot to do with the cost issue. But we're hearing now an ounce of prevention is worth a pound of cure, pretty much.
Absolutely.
So I'm really glad we're having this conversation.
Cool.
So I'm thinking we take a break.
Sure.
We come back, we get into some of the financials and insurance stuff, and we continue to educate.
Talk about the fun stuff. Huh?
Absolutely.
Okay, good enough.
What it's all about.
All right. Thanks, man.
So we are back
Yep.
with Doctors in the House. We are really glad to have you joining us today, and we are talking all about dental health and really talking a lot about gum disease. And we've kind of gotten into some of the things that keep people away from coming into the office, realizing it's important. So let's talk a little bit more about the finances and why it makes sense to make this investment to get this maintenance care and preventative care. So give us an idea, what usually is covered when they come into the office by insurance, assuming they have insurance?
Right. Now, believe me, I'm not the insurance expert, but usually for most folks, hygiene services are covered.
Okay.
It's when you have people who have the more advanced cases of things, there tends to be limits put on.
Okay.
It's like as if insurance companies try to pigeonhole everybody with the same shoe size, and you can't do that. If you have a mildest case, and Mr. Smith has a advanced case, you can't treat them the same. And Mr. Smith was just generic name.
Right.
Yeah, you know. Joe Johnson, whoever. Yeah.
Joe Williams.
Joe Williams, yeah. You can't do that. You can't offer the person with the advanced case the same treatment that the person with the mild or even the person with the moderate. Okay, a person with an advanced case of gum disease, they might require surgery.
Right.
They may require medicines. They may require extra visits. They may require, oh my goodness, bone surgery, flap surgery, where you flap the gums back. You know, there's just they may require laser treatment. And these are things that sometimes you have to go to battle with insurance companies in order to get them to help this person.
Does it work?
Yeah. Well, yeah, it works. It just, you know, first of all, you have to if you convince that person that, you know, we can help you, we can get rid of this condition, you're usually all in. But sometimes it's a battle because you're trying to recommend the best treatment modalities for these people, and insurance companies are fighting you tooth and nail, saying, no, we won't cover that laser treatment because it's, optional. You could have done this lesser treatment for Mr.
It's funny too because when I get into this conversation about insurance issues and dental, I'm taken back to, what was it, 5-10 years ago when the little boy died.
Oh yeah,
abscess.
yeah.
And then the state started funding pediatric, but not adult.
Wow.
So peds now, I believe, gets coverage, but the adults don't.
I hear about that case a lot. That case comes up a lot. And that happened a long time ago. It's hard for me to imagine the extremes of something like that where a abscess got to that degree where it caused sepsis so bad or something. I'm not quite sure what was the final thing that made that little boy ill.
It's funny too. Yeah. As I have this conversation with you, I'm thinking about all those patients, dental patients, who come to my office because they don't have insurance. Right. They want me to do something, and I make it clear I'm not a dentist. Number one, number two. They want an antibiotic to treat the infection, and as we know, that's not going to cure anything. And I don't know, but you probably remember how a lot of people were referred to the dental schools, and the students would work on them. But I'm being told a lot of those clinics aren't even around anymore. But the indigent population used to do that.
They are. Some of them are around. I know there are a lot of state. There's still a lot of. I forget what the state insurance where there are a lot of clinics out there, especially for the kids, which is a good thing. It's a good thing. I just, it's funny though, but that story comes up quite often. And again, and in all of my years, I've seen some bad infections, but I've never seen anything quite like that.
Really?
It's just hard for me to fathom something getting that bad. Where someone would put that much neglect on a situation where there was nothing that could be done. It's hard for me to wrap around that way.
Sometimes you can forget too how close the oral cavity is to
the
brain.
No, it's right there. Yeah. It's right there. But I'm sure, I'm not saying that it's anyone's neglect, but I'm sure multiple people looked at this situation,
Wow.
And if it was that bad at that point in time, it's look, sit the kid down. This thing's coming out now.
Yeah. So I guess at the end of the day, this is all an investment in your health, and people have to be responsible enough.
Yeah.
Now, do you do braces too, stuff like that?
Yeah, I do. I do more of. There's a special name brand of braces. They call it Invisalign. Okay. And the reason why, like I said, most adults don't like the traditional wires and like you put on the kids.
Train tracks.
Yeah, the train tracks. Yeah, most adults, don't like that. It reminds them when they were 12, 13, and 16. Yeah, so I do most of the invisible braces. I do some wire cases. It's limited, but I find the Invisalign procedures will treat 90% of the cases.
Oh, really?
Okay. Not unless there's some difficult cases out there, and then when they get that difficult, I'll send them to orthodontist. But I'll say 85.
Wow.
I'll say 85. They'll say 85.
That's interesting.
Yeah,
That's interesting.
Yeah.
Wow. Yeah. Cool.
Yeah.
Yeah, it's funny because me, on a personal tip, by the way, I was born with a gap.
Right.
And for me, I was always cool with it. And I guess I always could have had it closed if I wanted to. When my kids got theirs, my wife went ahead and they got braces and she closed it up, man. And even now, my brother, as an adult, went back and got his closed up too. And I don't know, man. I've been kind of cool with the uniqueness of mine. But are you seeing people like someone like me getting braces or something like that?
I would make that like a total personal thing. In some cultures.
See, I knew you were smart, man. I knew you were smart.
In some cultures, listen, let me tell you something. I don't know if you're familiar with some cultures. Like, like I have a lot of African patients, Nigerian patients. The gap is actually considered a sex symbol.
Right.
Okay, so man, consider yourself lucky, man.
Right. Exactly. You better use it, right? You better use it.
Hey, I'm telling you, you get in trouble if you close your gap if you like you're from certain countries. So I'll just ask people, is that an issue for you? And if they say no, I don't want my gap closed. No, it's not. It's no problem. I have no issue with that at all. Yeah.
So we're having a lot of fun, and I hope we're educating people out there because we're talking about some really important stuff here. Why don't you tell us about any gadgets you might have in the office?
Oh my goodness!
That help
don't
keep
start.
people healthy.
Don't start. Well, let me just, as like I said, I've been doing this for a while now, and one of the things that's happened since I've been out of school is back in the days, and I'd say back in the 80s, 90s. There were a time where specialists were doing lots of things that the general dentist could not do.
Right.
Dental implants was one of them. I'm God, that was one. Root canals, that was another thing. Yeah, you had to go to a specialist. Now that that has changed, that mindset has changed. So I'd say about maybe 2005, I started getting interested in dental implants.
Oh, really? Okay.
Yeah, it was just something that
So what does that mean?
Or
dentures?
Yeah, dental implant. So a dental implant is basically it's a titanium cylinder, okay, and you, lack of a better term, you screw it into the gum. It's screwed into the bone. I'm sorry, into the bone. Okay. The body heals around it, okay,
right,
and the body, the bone integrates around it, hardens, and it locks it in place. That is the basis of a foundation for you to now put a tooth there.
Wow.
And it most resembles the natural way of how you restore a tooth. You put a base over a root, and then you can make a tooth that fits down into this artificial root. And it's the same materials. People ask me all the time, what's it made out of? And I say it's made out of the same material that's been used for years for people who are getting hip and knee replacements. It's titanium.
Oh, wow.
Yeah. So it's not something, it's not a foreign metal or foreign, it's something that, most people, it's compatible with, I guess 97% of the population. I don't know if people have titanium allergies, I don't know. But it's rare. Wow. It's rare.
I guess they go under local for that?
Yeah, for the most part. Depends on the degree of or how many you have. I've been doing it for a while now. I've had a lot of continuing education. I got a fellowship, from like over 300-400 hours of continuing ed. I mean, I really started getting into it.
Oh, wow.
And not that you get to go to some nice places too,
Nice.
So,
hey,
hey. So, I mean, but it's fun. It's gotten to be fun for me. So that's become like one of the major emphasis of my practice now. That me doing dental implants.
Who's a typical patient who benefits?
Late teenagers, and I mean 18-ish. up to older people who, I've had a lady, she was 75, and she just got tired of her missing teeth. Wow. And this is what really started to get me into it. I have, for years, I've had older folks due to gum disease, lost all their teeth, and they had to wear dentures. Okay. At some point in time, dentures start to be a nuisance.
Right.
They don't fit. Okay. They get loose. They wobble around. And there had to be a better way. There had to be a better way, you know. So I started, you know, you start to read and you start to learn. And there was these smaller implants that would attach to dentures that would pretty much lock them in place. And it would eliminate stuff like polygrip and all of that sort of stuff where people would have to do to keep their dentures in. And it just grew from there. So it got from working with dentures to doing individual teeth to doing just big amounts of implants. And I just like doing it because it really, really, really gives people like their self-esteem back. When you look up and you got someone, whose mouth was a total wreck, and you got teeth that you can put in someone's mouth and they stay in.
Wow.
Yeah,
that sounds exciting.
Yeah,
man.
it
really
is.
does.
Yeah, it really is. It's very gratifying too. It's very gratifying.
So typically, how long would that take to do one?
It depends. Every case is different. The single implant, if you did one in a say like in the molar region, I don't want to get too technical, in the back, say like someone that got an implant in the back of the mouth, the standard way to treat it is you put the implant in, let it stay in for minimum 90 days. If everything looks nice and it's nice and healed, then you can restore it. Now, everybody's different. Sometimes you have to wait 4 months, 5 months. It depends. Now, there are situations where you can put things in and put something in right away. You can put implants and then, you know, they call immediates.
Oh, really?
Yeah, but the only issue with those is that the patient has to be very careful on what they eat. They're limited to soft diets because if they start chewing on meats and things that are very, very tough, and it can loosen the implant up. Wow. So, you know, yeah, they get the cosmetic need, but they have to be very careful, you know, during that period while the implant's healing.
So do you want to mention what the ballpark range might be for that?
For like that? A single implant, usually for the crown and the implant's about $3,000. Okay. Yeah, it's about $3,000.
Yeah, you're seeing more and more of these kind of things taking place, which I guess brings me to
I get requests for them all the time. There's a company out called Clear Choice, and they advertise all the time, you know, about doing implants in a day, da-da-da-da-da-da. A great company. I know they do good work, you know, but they're not for everybody, you know. Yeah.
So with the aging population, what are the typical things you might be seeing in this group of patients, older people?
Normally it's you know, usually in older population it's tooth loss. You know, it's tooth loss. And you know, a lot of them are educated now. You know, they're just as hip to some of these gadgets, you know, that some of the younger kids are. But they come in and they know what they want. You know, it's like, I don't want a denture. You know, I want something that stays in. You know, and
I think what you're saying too is they want their quality of life.
Yeah, they do. They do. You know, it's like it used to be. You would hear people say, "I'm too old." I don't hear that so much anymore. If someone wants something, they want it. They want it. You know?
Wow.
Yep.
Good stuff. Yeah. Good stuff. So we are definitely having a great time here. We are getting towards the end of the show. Again, you are watching Doctors in the House. My name's Dr. Darrell Hill, 301-497-0401. Also, laurelmedicine.com. And if you want to introduce or say your information.
Yeah, again. Sure. Dr. Garland Davis, also in Laurel, Maryland. We're neighbors. 301-490-2900. The office is on Cherry Lane, right at the intersection of Cherry Lane and Route 1 in Laurel. And we are, I'll give you the suite number. We'll put you right on the doorstep, Suite 6. Yeah. Yeah.
Do you do anything with TMJ at all?
My TMJ treatment is very conservative.
Okay.
TMJ is it's one of those areas where first there's no real standardized test for diagnosing TMJ. Usually with TMJ you come in and you literally have to do I would say you have to run like this battery to see what it is you're dealing with. Okay. It could be a person's they have something because they're stressed, they're clenching their teeth. It could be from misalignment of teeth. It could be musculature. and sometimes you treat it with appliances. Sometimes you treat it with just like you would treat any muscle joint issue. It's stretching, muscle relaxants. There's so many different modalities of treatment, but the thing that is probably rare with TMJ is surgery. If you start getting into surgery and fixing TMJs, you can have something really serious going on. Right. That is above my pay grade. Wow. Yeah. I don't. That's not something that I get into much. But I'm very conservative. You usually start with very conservative, non-invasive type things in order to deal with TMJ issues. Yeah.
You know, it's funny as I sit here with you. We know the mouth has a lot of bacteria in it. And that bacteria now is being linked to so many different things. We always know about the endocarditis, the heart infection. But now, have you heard about the dementia connection?
No, I have not.
Oh, yeah.
No.
They're saying they're finding bacteria from the mouth in the brain cells of demented patients now.
Really?
And for you, why don't you comment, too, on what medications might do to the oral cavity if you're noticing anything there?
Well, one of the biggest issues we have is, overuse of antibiotics.
Oh, really?
Yeah. Well, in the sense that, sometimes you get folks who they want to continuously be on antibiotics.
Really?
Yeah. Oh, yeah. Especially, well, let's put it this way. They have a problem.
Oh, okay.
Yeah, they have a problem, and you start them off on antibiotics, pain reliever, and then a week later they want more antibiotics, and then the next week they want more antibiotics.
Wow.
Okay. At some point in time, Mrs. Jones, you're fine.
Right.
Okay, you're fine. I mean, you said oral bacteria. There's a lot of bacteria in the mouth, but there is a baseline of things that exist there, and when they get out of balance, other things start to take over.
Right.
So you can get people. They start taking. They start getting overzealous with antibiotics, and you can start developing things like thrush and yeast and Candida, and so someone starts going on this 4 weeks of antibiotics, no, Mrs. Jones, you're doing fine.
So you kind of raised another issue. How do you address halitosis?
Normally through hygiene. Like I said, normally when someone comes with bad breath, you can get into. I know some folks, it's GI, it's diet, it's that sort of stuff. But for me, the first line of attack is through hygiene. Get their mouth free and clear of like bacteria and plaque and because that stuff carries sulfur odor like you wouldn't believe. Okay, you start there before. Now, if you do that and then someone says they're still having bad breath, then it could be the thing where you may have to send to an ENT. It could be something sinus related. Someone is constantly mucus draining and stuff. That can also cause really bad breath and that sort of thing. Yeah.
What are some of your go-to products for maintenance of the oral cavity besides toothpaste? Listerines, those kind of things.
Again, there's there are a myriad of mouthwashes and things like that out there. I hate to say there's a magic mouthwash because there are different products for different things. Like there are rinses for dry mouth. Like there's a product called biotin, which is for dry mouth. There's products for mouth sores or irritated gums. But there was a product that they had out there there's a new product out now. It's called ProDentex. Okay. There might be some promise with this stuff rinsing and helping with reducing bacteria in the mouth. But I hate to always give people that fault because you know how folks are. They want that magic bullet, that magic thing, that magic pill, and you tell them use Viadent or something like that, and it's going to cure their whatever. No, you have to do the basics. You got to brush, floss, and see us 3 times a year, and
And I guess you make a good point. So many people aren't doing that part, and they're looking for a quick fix, like everything else
all
in
the
society.
Time. Yeah, can I have a pill for that, Doc? Can I have a pill to get these 50 pounds off, Doc?
Wow.
Yeah.
Well, that brings me to another point.
Yeah.
What about foods? Are foods having an effect on the oral cavity, and what are your recommendations, if anything? There?
As has always been like the standard, and I'd say this has been for years, you have to, there's so much sugar in the American diet, and it's hidden. I mean, it's everywhere. And we have to tell people, because folks are getting more educated now. They are, and you may be seeing this. People are getting more educated to sugar now. They know what sugar's doing to them now. But I have to tell people, because they're giving kids like all of this juice, and I mean, I say, yes, folks, the juice is good, but juice is just basically, it's just natural sugar. Exactly. And it's doing the same thing as if you gave them a Tootsie Roll. Right. It's like you don't let your child go to bed with juice in their mouth. So again, we just have to just educate them to how much sugar is out here in society, especially in soft drinks. It's in the energy drinks. It's in these what are these drinks? Red Bulls and all of it. It's in just about everything. And there's so much hidden sugar in the diet. And like I said, I'm sure you see it all the time in your practice. The ravages that it's causing people with type 2 diabetes and weight gain, on and on and on and on. So it's the same thing with oral cavity. And it's like I guess at one point in time, there was this. They said that there was going to be elimination of cavities and da da da. It ain't going to happen. It's not going to happen. Right. Not the way they. As long as they're still processing foods the way they are, it's just I can't see it happening. Yeah. Yeah.
Yeah, I feel like I guess there are different genetic predispositions to decay in the mouth too, and how sensitive people may or may not be. Some people.
Yeah. I would say so. Yeah. I mean, I can't. Again, everyone's different. I get surprised sometimes where I come in and someone says they haven't been in a long time, and I check their mouth out, and it's like, wow, this is amazing. Right. Things look okay. And then you get a guy who goes out for a year, and you come back with good. You got 5 more cavities. What the heck is up? And there is some genetic disposition to everything. So you can never, like I said, pigeonhole people into one category. You got to treat everybody differently. You just do. So
I feel like we talked about a lot of stuff today. Anything else we need to talk about before we wrap it up?
Where'd the time go?
I know. I told you.
Where'd the time go, man? Yeah. No, this is awesome, man. This is awesome. I feel thoroughly privileged to be asked to come and visit you today.
Hey, we're happy to have you, man. I think our audience is especially happy to be hearing about what we talked about today.
Yeah.
So I guess we got a few more minutes here, so we can take a question from our audience. You have a question for us at all? This is a call-in show, by the way. I got so tied in today, I didn't even put that up there.
Did we not? Did we blow past that, or?
Well, a lot of times during the show, I'll read that number out.
Got it.
But since we have a live audience in the studio, any questions?
Yes, we can. There is new technology. One of the things that, I don't know if you don't have any crowns, but just about everyone who's gone to the dentist has had crowns. But there's a process you go through. It usually takes 2 weeks. And we have technology now where you can have it done in one day.
So quick, what is a crown and what is it used for?
Crown is when you have like major destruction or damage to a tooth. Okay. And then at that point in time, a filling is now inadequate. You can't just plug some material in the tooth to plug a hole. You have to cover the entire tooth to protect the tooth. But the thing with crowns is just sometimes it's inconvenient for people. You have to make a temporary thing to cover their tooth, and the temporary comes off during the course of 2 weeks, waiting for it to come back because you have to send it out and have it fabricated at a laboratory. So we have technology now. Again, you can scan the tooth. Patient waits 2 hours, and in 2 hours they can have their crown. So it's very convenient. Very, very convenient. Very, very convenient. It is. Like I said, I love the technology. But it's just one of those things that as long as they keep inventing new technology, I think I'll just keep doing it.
Well, hey, we've been happy to have Dr. Davis in the house today. I think we learned a lot. We're going to continue to promote this information to anybody we can because it's all about good health, medical, dental, you name it. So I'm going to go ahead and say Time is now 5:30.
Yeah.
And we will see you next week.
Okay.
Cool.